It has been quite some time since we saw a COVID press conference from Governor DeWine. However, that's exactly what happened this afternoon. Senior health correspondent Monica Robbins brings us the why and what we need to know right now. And Monica, cases apparently going up.
Yeah, I mean, we're seeing that across the country, and yes, we are seeing it here in Ohio, but nothing compared to what we were seeing during the pandemic. However, keep in mind, the governor just got over his recent COVID infection, and he says he's doing quite well, but he wanted to address the COVID issue because he's getting a ton of questions from other people relating to the booster vaccine. So since the new booster became available last week, nearly 88,000 Ohioans received one, the vast majority over age 60, and that's who the press conference was aimed at today. Now, we're still seeing 2 deaths a day in Ohio from COVID, and the new booster is available for everyone over age 6 months, and it should be covered if you have insurance, and for those who don't, resources are available.
Federal Vaccines for Children program that allows ODH to offer vaccines free of charge to eligible children, including those who are uninsured, will be available through our network of VFC providers. And for adults who are uninsured, the CDC has created a bridge access program.
Now, we're still getting some information that there's some areas where shots are not available. Keep in mind, pharmacies are now getting the vaccines direct from the manufacturer. The state and the federal government not providing vaccines anymore. If you are having issues, though, advice is to go to vaccine.gov and search for access to a booster near you. And the current advice is, regardless of how long it's been since you've been vaccinated, or even if you've never received a vaccine, is to consider this a new vaccine and go get one. Again, very much like the flu vaccines we get every year, they suggest that this is a new vaccine. You should get a flu vaccine, COVID, and RSV for those who qualify, Laura.
Okay, so I think a lot of people are wondering, if they just had COVID, do they really need to get the vaccine at this point?
Yeah, Dr. Vanderhoff said you have a 3-month window of natural immunity, but strongly suggests you still get this new vaccine 3 months after your infection, especially if you're over age 60 or you have an underlying condition or you have some type of immunocompromised situation.
Going back to the governor, Monica, do we know how bad his case of COVID was? Any insight on that?
Yeah, you know, he said it was a very light case, but keep in mind, he received the antiviral treatment. And a recent study by Cleveland Clinic shows those drugs like Paxlovid and Lagevrio reduce hospitalization and death in high-risk patients, even with mild disease, and even with those new Omicron subvariants. Now, the study comes from an analysis of 70,000 clinic patients who received those medications. So what we're seeing then is they work even if you have a minor case.
All right, a lot of information there. Monica, thanks so much.